Hey, welcome back to the show. My name is Roger Lodge, and ladies and gentlemen, it is time once again to get to our Sports Lodge Health Tip of the Week, presented by the amazing folks over at City of Hope of Orange County. And guys, most of you have heard me talk about my stepfather, the late, great Bob Lodge, former power forward out of Washington State, and how much he meant to me over the years. And you've also heard me say that, gosh darn it, my stepfather would probably still be alive if he hadn't smoked cigarettes for his adult life, for most of his adult life. And you have also heard me say that if you currently smoke, quit. Well, if my word is not good enough, here's what we've done. Here to give us some information, advice, and news on lung and thoracic cancers is an internationally renowned and award-winning doctor from the City of Hope of Orange County. She is known around the world for studying molecular signaling pathways in tumor development and cellular reaction to chemotherapy. Trust me, she'll explain. And her groundbreaking research has been published in multiple medical and scientific journals around the world. She is Dr. Tingting Tan. Dr. Tan, thank you so much for the time. How are you?
I'm good, thank you. Thank you for having me.
Thank you for being here. To start, can you give my audience a little background on your amazing career?
Oh, sure. Yeah. So my path actually has been very straightforward. I've always wanted to be a doctor. Biology was my favorite subject in school. I was fascinated by the science of medicine. And to me, also, helping people that are suffering from illnesses is one of the most rewarding things I could ever do. So, I fell in love with oncology when I was in graduate school. I did, many years of cancer research. And since then, I've been, in the past fighting cancer. And this is the best decision I've ever made in my life.
Tell me about the first conversation you ever had with maybe one of your parents, and you told them, how old were you? And you told them, I'm going to be a doctor.
That was actually when I was, graduating from high school, and my brother actually was 2 years older than me, and he was, ahead of me, and he went to medical school too. So, we were like a medicine family. So it was no surprise that my parents knew that I was actually heading the same path as my brother. And my dad was actually, he was an office manager, but, in his dream when he was younger, he wanted to be a doctor. So he was very happy, and both of them were happy that we fulfilled their dreams.
Wow, that's amazing. Okay, so here we are. You now focus on lung and thoracic cancer. What kind of numbers can you share when it comes to lung cancer and throat cancer here in 2020? Are those numbers up, or are those numbers hopefully down?
That's a great question, Roger. The good news is that actually the number of new lung cancers and head and neck cancers as well in the United States has been going down for several years now, partly because people are quitting smoking. However, on the other hand, lung cancer is still the most common cause of death from all cancers. It claims more lives yearly than breast, colon, and prostate cancer all combined. So to answer your question, the good news, incidence is going down, but it is still a very serious problem. There's a lot of work to do, and a lot of people need our help.
So, doctor, how about the person listening to our conversation right now and saying, oh, what the heck? I've been smoking for most of my adult life anyway. It doesn't matter at this point. Why should I quit now? What would be your message to someone saying that?
Right. It's never too late to quit smoking. Especially, during the pandemic era, smoking doubled your risk of developing respiratory infections. It doubles your risk of getting sicker from COVID-19. So it's actually more important now than ever to quit smoking. And if actually, the number one risk factor for lung cancer is smoking. And yet, 80% of patients actually diagnosed with lung cancer are not active smokers. 60% of them have quit and 15% have never started. What it means is that even you quit, the damage to your lung is permanent, so it takes actually years to actually decrease your risk for lung cancer. However, the more you smoke, the higher the risk. So it's never too late. It's always beneficial, good for your health to quit smoking. And we have many, programs for smoking cessation, throughout Orange County, especially at City of Hope. We can help. If you want to, thinking about, quitting smoking, please give us a call, and we'll be happy to help you.
That is fantastic to hear. And by the way, so for someone that has never smoked in their entire life, yet they end up with the unfortunate scenario that they have throat cancer, what's the cause of that? Do we know?
We know some of it. We actually know more now than ever. So, besides smoking, there are other risk factors, especially breathing toxic materials like asbestos, radon gas. There are other, carcinogen, chemicals you can breathe in like uranium and arsenic. But, these are risk factors as well. But there are actually, genetic mutations that lead to lung cancer, especially young people, never smokers. So, this is, bringing us to the modern, precision medicine where we actually perform genetic testings, for individual patients, where we actually identify these, driver mutations in patients. And we have, novel target therapies that target this mutation that will actually lead to very effective treatment. We save many, many lives because of these new findings in cancer research.
Dr. Tan, I have my next question underlined like 3 times with exclamation points because I want to ask this question for not only myself, who is the parent of 2 teenagers, but all the parents listening right now. There are so many kids out there who think it's cool to vape, this vaping thing that a lot of youngsters are doing. What is your message to all of the children out there who think it's cool to vape?
Yes, thank you for asking. I think it's very important actually to educate young kids. If they start vaping, they start smoking at a young age, thinking about the many years ahead of them, how much damage it can be done to the lungs. So vaping is just as as dangerous, as risky, and toxic, to the lungs as, tobacco smoking. So definitely, we need to educate our young kids to stop vaping, in any tobacco exposure.
So kids, no vaping, no tobacco. The effects are awful. Doctor, we're hearing more and more on this term precision medicine. Tell us about precision medicine and how it's being used to treat lung cancer.
Sure. Here's how I like to explain it. It's basically a plan for you and only you. You see, everyone is different, right? So there's no one in the world exactly like you. Your genetic makeup, your lifestyle, your environment are all yours alone. So if you have cancer, it's different than anyone else's disease. So it requires treatment that's as individual as you are. So that's precision medicine. Using this approach for lung cancer as well as other cancers, physicians actually will use genetic testing results of that particular patient and particular cancer to determine a way which is the specific drugs or treatments that have the best chance to work. So the goal eventually is to apply precision medicine to all cancers at all stages in all patients.
There's going to be a lot of people out there who are going to make the decision to do something about their smoking after they've heard our conversation. But some of them might be a little hesitant because of COVID-19 to enter a medical facility. Dr. Tan, while I still have you, what is your message to the folks who are hesitant to come to the City of Hope because of COVID-19?
Oh, thank you for asking. That's a great question. So the most important message I want to deliver here is that City of Hope is a safe place for world-class care. There are a lot of things we're doing to protect our patients, including temperature checks, masks, physical distancing throughout the office. The entire office and its surfaces are thoroughly and frequently sanitized. So we also have a stay well or stay home rule for staff. So it's very safe, really, very, very safe to come to City of Hope for your cancer care. So if you have cancer or, you are thinking about you have any concerning symptoms, cancer does not stop because of COVID. So you need to continue care without interruption, including surveillance and active treatments.
So if you're looking for care, you need maybe even a second opinion, call immediately 949-763-2204. That's 949-763-2204. Or you can always log on to cityofhope.org/Orange County. Dr. Tingting Tan from City of Hope, I cannot thank you enough for your time. Oh, last thing, I promise. Mask or no mask, how important is it for people to wear their mask these days?
Oh, most certainly a mask, Roger. We should all be wearing masks. The evidence is clear that wearing a mask helps reduce the spread of germs and respiratory diseases. I encourage everyone to mask up.
Doctor, thank you so much. And on behalf of everyone listening, your career is amazing. We thank you for all that you do. And hopefully we can have another conversation soon because you were terrific. Thank you so much.
Thank you so much.
That is Dr. Tingting Tan from City of Hope offering up her expertise when it comes to lung and thoracic cancers. And this is our Sports Lodge Health Tip of the Week, brought to you by City of Hope. And again, if you or a loved one needs cancer care, call them immediately, 949-763-2204. Again, that's 949-763-2204. Or you can log on to cityofhope.org/OC. This is the Sports Lodge on Angels Radio, AM 830. Back with more after this.